Hi, and welcome to On Air with Vyaire, podcasts from the front lines, an educational podcast series featuring discussions with frontline medical experts about their experiences ranging from airway management or the dynamics of recognizing, preparing, and managing patients with COVID-19. At Vyaire, we are truly proud to partner with you on the front lines of the COVID-19 global health crisis, and thank you for the work you are doing to help improve outcomes for patients with COVID-19 around the world. The host of Podcasts from the Front Lines is Vyaire Vice President, Medical Director Michael Pedro, MD. This episode is focused on airway management and features our guest medical expert, Lorraine Foley, MD, Executive Director, Society for Airway Management. This podcast is for educational purposes only. The scientific exchange content in the Podcasts from the Front Lines may address the off-label use of Vyaire devices and supplies that are the sole responsibility of the device or supplies owner, and is undertaken with the understanding that the owner assumes all liability for such use.
Hello, and welcome to Vyaire's first COVID-19 podcast. I'm Dr. Mike Pedro, board-certified anesthesiologist, as well as Vice President and Medical Director for Vyaire Medical. So the reason why we're here is I'm sure a lot of you guys are reading society guidelines on how to manage the COVID patient. However, after talking to dozens of clinicians, it seems as though there's a different reality out there. Due to the crisis, we don't have as many human resources. We also don't have as many resources in general, and it's challenging to adhere to those guidelines. So what we want to provide is realistic peer-to-peer discussions about the management of the COVID patient. Obviously, we want to share best practices with people that are managing COVID patients right now, what's working, and also what's not. We also want to bring awareness on the dynamics of preparation, recognition, and management of the COVID patients. Things are so fluid right now, and we want to just provide the most up-to-date, realistic information to you. And lastly, we want to honor the Vyaire commitment to respiratory leadership and products to support your healthcare professionals during this dynamic. So in today's podcast, we're going to discuss how administrators and clinicians are rearranging hospitals in order to support the influx of patients. We'll also discuss how to manage PPE, especially when shortages run low. And finally, best practice airway management protocols. Today with me, I have a very special guest. Her name is Dr. Lorraine Foley. She's also a board-certified anesthesiologist, former president of the Society for Airway Management. She's also the current executive director for the Society of Airway Management, and she works just outside of Boston, which has seen a big influx of COVID patients. So, Dr. Foley, thanks for coming on today.
Thank you for having me. Appreciate it.
So, like I said, talked to a lot of clinicians, especially ones that haven't dealt with COVID yet. And their hospitals are just starting to establish protocols for how they're rearranging hospitals, what they're doing with patients that don't have COVID that are in the ICU. Just curious, what's your hospital doing for patients that don't have COVID with the ICU, or how are they setting them up?
So presently what we have is we have COVID floors that are designated for COVID patients or suspected COVID patients. As time goes on, and that is actually expanding more and more as we're getting more COVID or suspected COVID patients. Again, we've eliminated all elective surgeries for the operating room, so that helps quite a bit, where we are only doing urgent or emergent cases. So it's getting harder and harder, I think, as time goes on, for people to be able to separate COVID from non-COVID patients this time.
And how are you managing escalations in care for, like, say, oxygenation? There's obviously a lot of talk about aerosolization if you're using NIV, if you're using high flow.
Presently, presently we seem to be okay. We're using nasal cannulas for the patients that are on the floor, non-rebreathers until they required intubation for those patients.
And has anyone that you know have been infected, the hospital staff?
As you know, most hospitals, at least in Boston, and like between Mass General, BI Lahey Health, Brigham Women, they do give a daily count, or they keep all the personnel up to date of what is going on. So yes, throughout Boston, in all the hospitals, not patients, but staff have been infected, or either tested positive or quarantined until the test comes back.
So I guess that brings the next question then is, how are you and your staff managing your PPE? And what are you using? Do you have everything available?
Okay, so I mean, first we started dealing with, for us, right now for us as the anesthesia department, at our hospital, we do all the intubations, including the ER, ICU, and on COVID floors and any codes, which is pretty much changed. Prior to that, we weren't doing all of them, but now we are. So working with infectious disease and what we have and nursing staff, as well as the OR staff, we found out what was available. Fortunately for us, our PPE, we do have the PAPR as well. But the thing is, what limits that is the filters. The filters only last for about 2 hours. So we kind of pick and choose what we do. So we have the PAPRs for intubation. We have then obviously the N95 masks and shields. But the other thing that we're actually using for more so outside the OR to save on the time for the filters is we're actually using the ortho hoods that the orthopedic surgeons used to use for total knees. And that's making sure, though, that we have our N95 mask on, and then we put on that hood, which gives us full head protection, including face and neck, because that's the main concern. Just using an N95 and a shield, you're still not covering your whole body and neck, and you don't get contaminated during the intubation. So those are the things that we've been using now.
I know that there's, obviously risk of shortage for PPE, especially N95 masks. In my hospital, we've tried to do different things such as disinfect them, save them, put them in a brown paper bag. Is there anything that your hospital's using? I've heard of UV lights some people are using.
Yeah. So the N95s, everyone is supposed to put them in the paper bag. The reasoning for that is so that the mask dry out better. We actually are a UV light to sterilize that. Looking, is it going to work for coronavirus? No one's looked at that, but it does work for viruses, and keeping it under the light for about at least 30 minutes is what we've been using. The N95s, but now our hospital has actually switched over that they are waiting to be approved to be able to sterilize our N95 masks at least 3 times after use. That said, in the news today, and as you know, Mass General Partners just has a new N95 mask sterilization that's been approved. So they're going to be able to do about 80,000 masks a day. Presently, we don't have that, but we're going to be doing this other way of sterilization.
Awesome. That's
but in the meantime, in the meantime, though, between those, when we use it, because they still expect you to use it for a day, most places do, because we do have a shortage. We after we use it, we do stick it underneath the UV light, hoping that it will help do that.
Oh, that's fantastic. Glad that you guys are coming up with ways to manage PPE as the shortage becomes realistic.
Thank you for joining us today. To suggest a topic for future podcasts from the front lines, or to stay informed, please visit us at Vyaire.com.